Super. Okay. So welcome, everyone. Welcome to 2021. It's going to be an exciting year ahead, I believe. Thank you for joining us for our weekly COVID-19 situational update. We just ask that everyone make sure their mics are muted while we proceed with the presentation. Very pleased to welcome several guests with us today. We have with us our board chair and mayor of Selwyn Township, Andy Mitchell. Chief Laurie Carr from Hiawatha First Nation, I believe is with us or will be soon. And Mayor Diane Therrien will join us, as well as MP Mariam Monsef. We're also very fortunate to have with us today the Executive Director of Community Living, Teresa Jordan. So thank you so much, Teresa, for joining us, and we will turn it over to you in a little bit. So as we start, I'd like to begin with our land acknowledgement with another image featuring our beautiful area at this time of year. So as we gather, we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. So to begin with, we have some opening remarks from our chair, Andy Mitchell. So I will turn it over to him. Go ahead, Andy.
Thank you, Brittany. During the past 2 weeks, Peterborough has been experiencing a significant increase in the number of new COVID-19 cases. This health crisis is not something happening only elsewhere in the province. It is happening here as well. As we continue to battle COVID-19, our response should be shaped by each of us taking personal responsibility for our individual activities. What others do should never be a reason for taking actions that place our community's health at risk. The basic public health guidelines in respect of not assembling in groups, maintaining physical distancing, wearing a mask, washing hands often, staying home if you are sick, as well as the additional limitations announced on December the 26th, need to be adhered to by everyone. No matter your politics, no matter whether you are wealthy or of modest means, no matter whether you are young or old, no matter whether you live here some of the time or all of the time, and no matter whether you have underlying conditions or are healthy, remember, the public health guidelines and the lockdown provisions put in place December 26th apply to you. The people of the broader Peterborough region are strong and resolute. Our community has weathered difficult times in the past and has always come back to thrive. We will do it again. By adhering to public health measures, we will protect our families, our friends, and our community. Stay well, stay safe, and be kind. Thank you.
Thank you very much, Andy. And with that, I'm going to turn it over to Dr. Salvaterra, who has some good news to start us off with, and then we can move into our situational report. Go ahead, Dr. Salvaterra.
Thank you so much, Brittany. And I know with all the attention on COVID-19, many of us are unaware. We've lost track of influenza, which is typically the virus that's causing us trouble at this time of year. So I'd like to start with the good news story, and that is that we have no reported cases of influenza in Peterborough at the moment, and we have no outbreaks, influenza outbreaks. So that truly is good news. So thank you to everyone for getting immunized and also for keeping their distance. I think this is an indication that people are, to the most part, following the public health measures. So if I could have the situational update. covering the last 2 weeks since we have met on December 23rd. These are our current case details as of yesterday at 4 p.m. You can see that we're reporting 89 active cases. 2 weeks ago, there were 27. So this represents a tripling of our cases over the past 2 weeks. We also, in total, have reported 399 confirmed cases since the beginning of the outbreak. This number has increased by 119 in the past 2 weeks. Our public health team is following 177 close contacts. That's up from 107 2 weeks ago. And fortunately, despite this significant rise in cases, there has been no change in the number of deaths in our community. These remain at 5. As far as our new cases reported by date, you'll see here on the graph that for the week of December 28th, we reported 71 new cases. And for the week of January 4th so far, we were at 13 new cases yesterday evening. I can assure you this has increased again. And you can see that the steady rise of cases at the end of the year and in December, there were 137 new cases for that month. So far in January, at just on the 6th, we are already at 52 cases. So the trend is definitely worrisome. It's an increasing number of cases. If we look at exposures, close contacts here on the right-hand side, you'll see the top bar that close contacts continue to be the highest source of exposure at close to 60% of all our new cases so far. Community spread is definitely a factor, and it represents 20% of our cases. I think this slide emphasizes the value of early testing, early identification, so that we can isolate all of those high-risk contacts, many of whom go on to be infected as well. So good work, Peterborough, in getting tested early and allowing us to assist with isolation and containment of the outbreak. The next slide breaks down our cases by gender or by sex and by age. And you can see here that where it was predominantly more females than males, we are now showing that this has flipped, slightly more males than females. And I believe this is because of several recent household clusters that have occurred among young single males who are sharing housing and also socializing together, and who often work in more than one workplace. I think the ages also show what we are experiencing. Certainly a large proportion of our recent cases, 130 of our cases in total, have been in the 20 to 29 age group. I could have the next slide, please. As far as testing, we almost 40,000 Peterborough residents have been tested now, 1,000 more over the last 2 weeks, and we have 1 in 4 of our residents having had at least one test. Our next slide summarizes what we're seeing in outbreaks. And I'm happy to report that as of last night, although we were reporting 4 active outbreaks, that has been reduced. We now have 3 outbreaks that are active, and that's because early this morning we declared Riverview Manor over. And that outbreak in a long-term care setting there was only 1 case In a staff person, happy to say it was well controlled. We now have no outbreaks currently in long-term care. One of the current outbreaks is affiliated with Community Living, and we are pleased to have Teresa Jordan joining us in just a moment to provide you with an update. Before we go to Teresa, if I could just comment on our case incidence rate, and here you can see what's happening across the province. Incidence rates are up, including in Peterborough. If we were still using the framework, the provincial framework that was in place before the shutdown, you will see that Peterborough would be either orange, as shown in this map, or actually red. If you look at our case incidence rate for the last week, we saw 47 cases per 100,000, which would put us in the red zone. Our percent positivity for testing, which is now at 1.85%, aligns with the orange zone. And when I look internally at our public health capacity and our performance over the past week, given that we are still able to contact our cases within 24 hours of receiving the positive result, my estimate that, if the shutdown were declared over today, Peterborough would find itself in the orange, moving towards red. So important to remember that as we continue the rest of this media briefing, we have cause for concern in Peterborough. So before I make any additional comments, I would like to give Teresa Jordan, who is the Executive Director of Community Living Trent Highlands, an opportunity to provide you with an update on the outbreak it being experienced there. So with that, Teresa, welcome, and please join us, and the floor is yours.
Thank you so much, Dr. Salvaterra. Just quickly, I wanted to make sure everybody knows that Community Living Trent Highlands, we serve adults with developmental disabilities in 3 communities, actually, Kawartha Lakes, Haliburton, and here in Peterborough. We have a host of supports and services in those 3 communities, and this includes 16 community homes. So as we're aware, through Christmas, we have been dealing with our very first outbreak in any of our community homes. And that's here in Peterborough and was declared December 23rd. So in total, in that home, 9 staff have tested positive. 5 of those staff are now resolved. There are 5 people who live in that home, and all 5 did test positive. As of today, 2 of those people are resolved. So we continue to be in outbreak. I can't stress enough how diligent and dedicated the team members have been. So many people have taken on extra work. There's been a great show of commitment, and the entire Community Living Trent Highlands community has really rallied around our home here in Peterborough. I'm grateful to the partners. I'm grateful to public health. I can't say enough about having an outbreak in Christmas, but we were supported every day at any hour through with public health through the Christmas pseudo vacation for most of us here at Community Living. All our partners around have been really supportive. We have learned a lot. Certainly we were following the provincial guidelines handed to us by our ministry and working closely with public health, but there has been much to learn in the outbreak that we are implementing as quickly as we can across the agency, and of course more review will come in the following weeks. Our first priority, of course, is getting through this outbreak and ensuring everyone is restored to health, and I offer my thanks to the community for all its support. It's been just, as I say, tremendous, and so many people made themselves available to us all throughout the holidays, so I really appreciate that.
Well, thank you, Teresa. Thank you for joining us and for being available to the media for for their questions. And so I'd like to just make a few remarks, if I may. So I'm not sure if it was the Christmas shopping or the socializing associated with the holidays, but certainly our rates of COVID infection have soared over the past 2 weeks. And this is not isolated to Peterborough. Communities across the province have seen the same trend despite the shutdown coming into effect on the 26th of December. Here we saw the beginning of our surge really on Christmas Day with a tripling of our usual number of daily cases. And this has been sustained with a record number of 20 new cases being reported one day this past weekend. Our nurses who are doing the follow-up report that most of the spread is from socialization. Not only were Peterborough residents entertaining family members from provincial hot zones, but they had guests in their homes whose last name they didn't even know. And some of our latest cases have reported so many gatherings that it is impossible to pinpoint where exactly the exposure took place. So clearly this outbreak is out of control. As of this morning, as you heard, we are following close to 90 active cases and 200 high-risk contacts. Based on our most current weekly incidence rate, as I said earlier, if we were not in the midst of this provincial shutdown, we would have gone from orange to potentially red this week. So Peterborough, we do need to do better, and I am calling on everyone to adhere to these provincial shutdown requirements. We must stay home. And we must not allow anyone except for essential caregivers into our homes. Indoor gatherings of any kind are illegal. And the reason for this is that we have a virus that is transmitted while people feel well. If you have had any contacts, whether when you're outside of your home, whether it is grocery shopping or working or attending school, you are potentially a vector for this virus, even if you feel well. I also need everyone in Peterborough to get tested and to isolate at the first hint of an illness. I'm worried about the undetected transmission that is occurring in our community, and it will be much more difficult for us to bring a raging fire under control. I need everyone to trust that Peterborough Public Health will help you stay safe and help keep others safe if you test positive. We can only do that if you take the first step and get tested. And with an incidence rate now of almost 50 per 100,000 in our community, any new symptom could be COVID. It really alarms me that people are getting tested and then going to work or are socializing while awaiting their results. This violates the existing Section 22 class order, which I issued this past spring. And having a symptom and getting tested triggers self-isolation. So we need everyone to understand that we are most infectious early in our illness. In those 48 hours before we even feel sick, and in those first few days when we are ill, we are shedding lots of virus, and we are at greatest risk of infecting others. As our immune system kicks in to control the virus, we become less infectious. With most people clearing COVID-19 at 10 days after the onset of their symptoms. People with more severe disease or who are immunocompromised take longer to clear the virus. Right now, we are clearing them 20 days post onset of their symptoms. So please, If you're being tested, go directly home from either Northcrest Arena or from the hospital. Do not go shopping. Do not visit friends. Do not go to work. I'm also asking all employers in Peterborough to ensure that they are actively screening their staff so that anyone with symptoms does not come to work. We will be calling the Ministry of Labour to assist us if enforcement in workplaces is necessary. And although I know and am grateful for the federal assistance for lost income due to COVID-19, I also know that many of our community residents are precariously employed and housed, and they do not have the luxury of time to wait for that federal assistance. So I do ask that employers provide their staff with paid sick time during this pandemic so that people will stay home and will stop the spread. I also ask that any resident who has a medical exemption for masking stay home and conduct all of their essential shopping or errands virtually. Using face coverings is the way that we protect others in case we are shedding virus. So if a mask is not being worn, it's best not to be indoors with anyone outside of your household. So now more than ever, full compliance with masking is necessary in all of our indoor settings. If you must go out and can't wear a mask, I recommend a face shield be used as an alternative. And if you are offered a face shield by an operator or a business that is offering to accommodate you, I'm asking that it be worn. Otherwise, do your shopping from home. And finally, while we are encouraging outdoor activity, unless we can prevent crowding at our outdoor rinks and toboggan hills, we will see transmission of COVID occurring at those sites. I know that the City of Peterborough will be posting capacity limits for these sites this week, and I urge everyone to respect those limits. If a rink or a hill is at capacity, please look for another spot or come back at another time. The playing of sports is not allowed, and we request that people wear face coverings as an added layer of protection for others. There will be increased monitoring and enforcement this week of our outdoor ice rinks and toboggan hills. And if I do not see better adherence, I will have no other option but to order that these areas be closed until the outbreak is better controlled. So I'll stop at that. Thank you very much. Over to you, Brittany.
Thank you, Dr. Salvaterra. We will now invite our elected officials to share any remarks before we move over to the media question opportunity. So I'll just check to see if Chief Lori Carr is on the line and if she wants to share any remarks. Maybe she wasn't able to make it after all. Okay. Then I will move over to our mayor, Diane Therrien, if she has any remarks she'd like to share.
Thank you very much, Brittany, and just want to echo the comments made by Chair Mitchell and Dr. Salvaterra. I know that it's been a difficult, 10 months, and we certainly want people to be getting outside. It's good for your mental health. It's good for your physical well-being. But as was said, we have been hearing that some of the facilities are getting very crowded. And so we know people want to use them, and we encourage people to get outside and to do so, but in a way that is safe, because we need to make sure that we are slowing and stopping the transmission. Otherwise, we're going to have to be in a position where these facilities are not made available. And so the city has posted information about the neighborhood rinks that are available. We encourage people to get out again and use them, but be smart about it. Maintain that distance, wear a face covering, be respectful of your neighbors and your friends. Again, this is about protecting other people as well as protecting yourself. And we are, all in this together. It's been a long haul. 2021, there's some light at the end of the tunnel, but there's still a ways until we get there. And so we all need to be pulling in the same direction and be adhering to these public health guidelines in order to make sure that we can come together again next year and hopefully have things somewhat back to normal. So I'll leave it there, but I will be around later for questions. Thank you very much.
Thank you very much, Mayor Therrien. And so now I will invite MP Miriam Montef, who I believe is with us, to share her comments. Welcome, Miriam.
Thank you so much, Brittany, for bringing us together. Hello, colleagues. Bonjour, Anin, salam alaikum. I'm on Mississauga territory in my home, in a wonderful place that is so much better off because of leaders like Dr. Salvatierra, Mayor Therrien, Mayor Mitchell, and so many others who've given everything they've got to keep all of us safe. I want to begin with gratitude and then talk about vaccinations. Gratitude for the frontline workers, those strong teams pulling together to fight the pandemic, to care for those who need it most, who work through their holidays and sacrificed time with their loved ones and who are still going and who are inspiring the rest of us to hang on and to continue to follow the very clear public health guidelines that Dr. Salvatierra has shared. I'd like to thank those who changed their holiday plans, who stayed home for a much quieter, probably lonelier holiday. To our community, to all of you who are making sacrifices, for being vigilant, for wearing those masks, which at times are not comfortable, for avoiding non-essential travel, for holding off on big celebrations, for grieving loved ones lost in new, safer, and more isolated ways, for getting tested when signs and symptoms of virus emerge, and for staying home until you get those test results, and for all the ways you look after your neighbors and your community. We thank you. We know that this pandemic has been really difficult, but for the most part, you have stepped up and you continue to step up, and a difficult year is behind us. And there is hope. There is light at the end of the tunnel, and that light continues to grow brighter with the ongoing rollout of the vaccine. Let me talk a little bit now about vaccine. We're getting a lot of calls in my constituency office about it, and rightfully so. As of December 31st, we have distributed, the federal government has distributed more than 420,000 vaccines to provinces and territories to deploy to Canadians. And we are on track to have at least 1.2 million doses delivered by the end of this month. Health Canada is currently reviewing applications for vaccine approvals from both AstraZeneca and Johnson & Johnson. And Canada has agreements in place to secure over 130 million doses of these 4 vaccines, including Pfizer and Moderna. I want to mention that we are on track with the vaccine rollout and delivering the vaccine to our partners across the country. And Canadians can follow along and track the vaccine rollout online on the federal government's website and see for themselves the recommendations to the provinces, the amount of vaccines that have arrived in Canada, and the amounts specifically delivered to each province. You will find that on the COVID website, the federal government's website on COVID. So For instance, here in Ontario, when you go on that website, you can see that about 150,000 doses have been delivered to the province and that they've administered about 1/3 so far. I want to thank everybody who's working hard to get those shots into arms and move us forward. And I want to stress that until all Canadians have access to a vaccine, we need to keep working together to slow the spread of the virus and follow public health guidelines. We will get through this together.
Excellent. Thank you very, very much, Miriam, for those comments. And I see that Warden Jones has also joined us on the line, and I'm wondering if Warden Jones has any remarks to share, or if you'd just like to be available for any comments.
Well, no, thank you. I'll be very brief. I think everyone has said the important matters we're dealing with. And again, I thank Rosanna for all the help and support that she's been demonstrating through this. I guess the only thing I want to say is we really do need to get through to these people who seem to want to protest this whole thing and go into denial. I'm hearing from them every day. I'm sure Diane is too, about how this is all phony and how their rights are being taken away. And you know, we really got to stop this nonsense and get together on this and all do the right thing. Let's be part of the solution, not part of the problem. And I just don't know how we do that. But that is my message to everyone. And I know everyone in Peterborough County are doing their very best to cooperate. All of our 8 municipalities, of course, we have our own unique little situations and challenges, but we're doing our very best to keep up with them. So I thank everyone for cooperating. Nothing will ever be perfect, no doubt, but as I said, let's be part of the solution and not part of the problem. Let's give our head a shake and get through this together. That's my comments, and I'm sticking to them.
Thank you. That's great, Warden Jones. So glad you could join us today. So I think that's everything from our elected officials. Just let me know in the chat box if you have any, if I've missed you, if you wanted to say anything. So now we will move along to our questions from the media. And Paul, I think you have a hand up, and not only that, you were first on the line. So I will invite Paul from Kawartha Now to kick us off with your questions.
Thanks so much. Can you hear me okay?
Yes.
Sounds to me.
Oh, okay. I wasn't sure. Teams is a strange animal sometimes. So I have a series of questions, actually. Most of them I think are for Dr. Salvatierra. And if you need to direct me to somebody else, that's fine as well. With the number rise that we're seeing, and as you said, our rates have soared. What's your message, Dr. Salvatierra, to people who would be discouraged by that? I mean, you know, we're doing, the measures are in, they've been stepped up. There's a possibility they'll be stepped up even more, depending on where the numbers go. But the average Joe sitting at home is doing all the right things. What do you say to them? Because those numbers can get one down, I would suspect.
Well, I would encourage everyone to really take a close look and reflect upon their own practices, Paul, to make sure that they are in fact doing everything within their power. So ensuring that they are staying home and that they are not leaving for things unless they are essential. And that first slide that we had up at the very beginning of the media scrum sort of tries to capture that, you know, do I really need to go out? Can I do it virtually instead? And when people are out, to make sure they continue with the distancing and with the face coverings. If you see a crowd, it's going to be up to you to turn around and stay away. You know, yes, we have enforcement in place, but really it falls to the individual. If you have a symptom, rather than ignoring it and hoping it just goes away, get tested. You know, go online, get an appointment, get tested. That's the only way you'll know for sure. If it is a positive, if you are tested, don't go shopping, don't go to work. Stay home until you get that result. Fortunately, we are seeing the majority of our test results back within 48 hours. So the testing, there's good capacity right now, good access for testing. And I think if everyone were to consider that they are a vector for the virus, even though they're feeling well, that they are a potential vector, I think that would hopefully give them cause to reflect and maybe make better decisions about what they do or don't do. I hope that's some help.
Yes, thank you so much. I wanted to ask a specific question regarding the community living outbreak. I'm looking at the list of outbreaks on the website. Are there 2 locations for that outbreak, or is it just 1?
No, we have 2 outbreaks in congregate settings right now, and one of them is the community living.
Right. So what's the other one? I'm sorry.
So the other one we haven't named on the site, I believe, unless Brittany corrects me on that. I'm not sure if we've disclosed whether we've disclosed where it is, but I can say that it is another congregate living situation.
Yeah, no,
Okay,
we've not
all right.
disclosed it on the site.
Okay.
Okay. And do you know, in the terms of the community living outbreak, how COVID-19 was introduced to that residence? Was it an outside worker coming in, a caregiver? Is there any idea?
I think that might be a good one for Teresa to answer. If Teresa, do you have a sense of how COVID was introduced into the home?
No, we don't have any clear indication. I mean, certainly staff were all aware of the measures they needed to take to keep themselves distanced as they went to and from work. There had been a couple of medical appointments for individuals, but no, we can't say how it entered.
Thank you.
Thank you, Teresa. Sorry, I would have had my video up, but I haven't combed what little hair I have left yet, so I didn't want to subject you to that. The other thing I wanted to ask as well was about the workplace outbreak that's listed. Can you give us any details, Dr. Salvatierra, on that?
I can say that the workplace closure was a voluntary closure. It's a small workplace, and people are all self-isolating. We have good cooperation with the workplace, and I think we've done extensive contact tracing. We are seeing some secondary transmission, but it's linked to household contacts rather than to the actual workplace itself. So I think that workplace is doing well, and they're cooperating with us with trying to control it.
Do you know how many cases were in that outbreak or reported?
I'll look it up, Paul, and I'll get back to you if I have it. I'm not sure I have it.
Please, if you could. And then the only other thing I had was, as you're well aware, this is relatively new. Quebec is looking at imposing a curfew situation in the province. Premier Ford hasn't ruled that possibility out for Ontario. In fact, quite the opposite. He's leaving it on the table as an option. That would present. I guess what I'm looking from you is just in terms of the challenge that would present if that did occur. You've got so many responsibilities up to this point that you've been looking after. That takes it to a whole new level once we get into a curfew situation. Is that something that you look at in anticipation of it possibly happening? Are you working on a plan for that?
No, I'm not. I can't say that we're working on a plan for that. However, I would like to add that certainly all of the medical officers of health are hoping that the province will take the additional measures that are necessary in order to contain this outbreak. And I certainly think there's more that the province can be and should be doing, and would welcome further measures like restricting non-essential travel, as one example that really needs to be done at the provincial level. It can't be done locally. And I would think, again, the example that you raised, Paul, of curfews would also be something done at the provincial table and not locally. The province does have the benefit of having the capacity to enforce these types of measures. They are certainly out of scope for a small public health agency like ours here in Peterborough. Out of scope and out of mandate.
Okay, thank you. And just one more thing. I'm sorry, I misled you. MP Monsef was talking in the latter part of her address about vaccines. And I guess the $1 million question that you're not going to be able to answer, and you know what this is when do you anticipate we may see some vaccines come to this region? And are you concerned? I mean, we have people and we have our share of long-term care homes here as well, and senior residences. You know, we see that being rolled out now in Toronto to all the homes this week. What are your thoughts on that? I mean, the sooner the better, clearly.
Oh, clearly the sooner the better. Yesterday would have been great. However, that said, there's no, I mean, vaccines are being delivered according to need. And there's no doubt in my mind that we have areas in Ontario where the risk is greater, the need is greater. We are very fortunate in Peterborough. Currently, as I speak, we have no outbreaks in long-term care. However, we have an increased incidence of COVID-19 and it's growing every week, and that will put the long-term care homes and the residents at greater risk. I don't have a date of delivery. I am expecting that we will have vaccine hopefully before the end of the month. And we are preparing for that scenario. So we are meeting tomorrow, for example, with all of our long-term care home partners, whether they're long-term care homes or retirement homes or congregate living settings. We are working with them. There's a checklist that will help them prepare their staff and their residents and their essential caregivers for immunization. We have consent forms that we will be sharing with them so that people can learn about the vaccines and give their consent, so that as soon as we get delivery of vaccine here in Peterborough, we will be immunizing in our long-term care settings. And so it's very exciting. And getting back to your earlier question, Paul, about message for the discouraged, the message is that the vaccines are coming and that we will be ready to go when they do arrive here in Peterborough.
And sorry, just one more thing, just to clarify, you anticipate we'll see some vaccines here for long-term care homes before the end of the month?
That is my hope and my expectation.
Okay, great. Thank you. I know it was a lot of questions, but I thank you as always for making the time, and thank you, Brittany.
Thank you very much, Paul. Great to have you back joining these.
Yes.
Okay, so I think I saw Matt Latour's name on the list as well. So Matt, if you've got any questions, go ahead.
Actually, it's Graham playing the role of Matt this afternoon. So.
Oh, you're doing a good job. Very stealthy.
A couple of things I want to bring up. And Dr. Salvatierra, I heard your tone during your address in regards to where we're at, where we're going, and if extra measures need to be put in place. Although on the flip side of that, I didn't do any shopping personally, but I did get many reports on Boxing Day that the big box stores were practically empty on Boxing Day. Now, this compared to maybe other bigger communities like in the GTA, for example, where they still see lots of shoppers at Walmarts and Costco's, where here the numbers were rather low. Were you happy to maybe hear something like that on Boxing Day there weren't hordes of shoppers out of these big box stores?
Yes, Graham. That was certainly good news for me.
And does that mean that maybe we're doing a better job of maybe getting that message out about what the wants and needs are for our community to make sure that we're doing what we can to stay home? And we saw very little traffic on the streets over the course of the week between Christmas and New Year's.
Those are all good signs. And because people do need to limit their trips outside of the home, and I would suggest that they try to reduce those to weekly, even for perishables, if they need to go out, and if they need to do shopping, that it be best done virtually. So if I know I'm trying to do all my shopping online and do curbside pickup. So curbside pickup is a great way to do it. It's safe, as well as delivery options. So the more of that we can do, the more people will be staying home, not traveling, and not spreading the virus.
For New Year's, and I haven't seen anything spectacular from the police services themselves. Have you had any conversations with either the OPP or Peterborough Police Service? Was there anything that may have come out of New Year's Eve that was of any concern to you?
Nothing that has come to my desk, Graham, for my attention. I understand from both the OPP and the Peterborough Police that they have been enforcing the provincial restrictions. But I don't have any details.
Finally, and I was going to ask about the curfew. Paul already covered that off, so we'll move on from that. But I want to kind of circle back to the vaccine, and I know that you probably saw the same news reports I saw just after Christmas of some concerns because the vaccine rollout had paused during the course of the holiday season. And I know this is twofold. It's very easy for us as the general public to go, well, the province isn't doing their job to get their vaccines out. On the same side, we do know as well that there's been a lot of hardworking people working in the medical field over the last, 8-9 months and leading up to this point is too, they need the rest as well. Were you concerned at all personally or from the public health level that there was a pause in the distribution of these vaccines, maybe delaying them coming into the Peterborough area?
Well, I don't believe that the pause that occurred over the holidays would have any impact on Peterborough. We were never destined to get vaccine until later. I was hoping we would get it mid-January. I'm hearing now potentially by the end of January we should have some. And we will do our best to be ready so that we do get it out. I certainly understand the fact that the hospitals that were delivering the vaccine before Christmas and during Christmas had very little time to ramp up and staff up those clinics. This was an unexpected role for them. I think they did their best. And I think there were concerns not only about their own staff being overstretched, because we know hospitals in those red zones have been dealing with COVID since the very beginning, and those healthcare workers have been working hard. But also there was concern about no-shows. And I certainly know that whenever you offer clinical services, even on weekends, there is a greater risk of people not showing up for their appointments. And this vaccine is so precious that not even a single dose can be wasted. So I certainly understand the decision and why it was made. And as I said, I don't believe it would have any impact on us and when we can expect to get our vaccine.
That's all I got. Thank you, Doctor.
Okay.
Great. Thank you, Graham. Okay, so I think I saw Taylor Clydesdale from Peterborough this week. If you've got some questions, please go ahead, Taylor.
Yes, hi, sorry. Just like Paul, I don't think I've looked good enough right now to turn on my camera. So just a couple of questions. I'll start out with ones for Teresa Jordan here. You and I were talking yesterday via email about the questionable PPE that was discovered in some community living homes. I'm just wondering, something that we didn't touch on was how is the questionable PPE discovered, and what were the follow-up stages when it was discovered? What were the steps that were taken after that?
So that's an excellent question to ask, because again, I can just highlight how hard public health was working with us. So Boxing Day, that's traditionally a holiday for most people, was the day that our public health person assigned was doing an audit of all the PPE. And so that was a process of just taking pictures of the PPE that we had at the home and available, and that was when it was established that some of what we were sending pictures of was not particularly authorized for COVID. And so immediately that was removed. And then equally, once we knew from the correspondence what PPE that we had available was authorized, we ensured that that was the only PPE available at all of the 16 homes. That happened. I think all the PPE was changed out probably by noon on the 27th. Again, given our geography, it did take a little bit of time, but certainly it didn't affect all of the 16 homes. As I said, we had a number of different sources. Early in the pandemic, PPE was hard to obtain, and so we did have some PPE from a variety of sources. But I can say that now all of the 16 homes strictly only have PPE that has been thoroughly audited and approved by Public Health in Peterborough.
And thanks, Teresa. And if I may add to that, so when our public health inspector looked at the PPE that was being used, there was no English labeling that I was able to confirm for us that the PPE that was medical grade. So it wasn't that we were sure that it wasn't appropriate, but it was just that we weren't able to confirm that. So because of that, on December 27th and 28th, we actually provided masks, and I believe on the 28th, we also provided some gowns to the home here in Peterborough. I think in addition, we were able to confirm with staff that there was one of the persons supported had an aerosol generating procedure. And so we were able to ensure that not only were staff aware that they needed to wear N95 masks for that, but that they all were fit tested as well, so that they had the proper masks available. So I believe those were the two major issues that were identified and were resolved very quickly by the home.
Then follow-up question then for you, Dr. Salvaterra. Is this a situation that you've seen pop up in any other homes or congregate care facilities in Peterborough, or in the Peterborough region, I should say?
I can't really answer that. I certainly can. We can look into that question, Taylor, to see how often this is an issue for our homes. I know that we did organize, in the case of community living, there was a meeting, a virtual meeting, and that the ministry was in attendance, and so hopefully this situation will be addressed in other congregate settings that are funded by that ministry, but that's something I can look into and get back to you on.
Okay, perfect. And thank you, Teresa, for chatting with me for the last couple of days and today as well. Dr. Salvaterra, then moving on to the next topic, but we've talked about how cases have been rising in the area. Just wondering, what are your expectations for January? Are we going to continue to be seeing cases rise over the next few weeks following the holidays?
I don't have a crystal ball, I'm afraid, Taylor. Santa did not bring me one, even though I asked for Christmas, so I'm not able to answer that question. We live with the constant hope that the next day will be better than the one before. And we never quite know what each day will bring. For example, late in the day yesterday, after 4:30, we had 3 new positive results. So we continue to monitor, we continue to live in hope that people will adhere, and that we can bring this outbreak under control. And as I said earlier, I also hope that at the provincial level, now that we are 2 weeks into this shutdown, that the province will reevaluate and will strengthen its measures to ensure that we have better adherence with the public health measures that are recommended.
Okay, I think that's it for me for today. Thank you all.
Great. Thank you very much, Taylor. Okay, I think Jessica Nisnik is on the line from Global. Did you have any questions for our speakers today, Jessica?
Yes, Happy New Year, everybody.
Hi, Jessica.
Thank you. I had a couple questions. Dr. Salvatierra, at this rate, do you see the government extending the lockdown?
Well, certainly, given the provincial numbers, Jessica, I think that is a possibility that we all need to remember. The shutdown was to be reevaluated, and we were told even before December 26th that at 28 days there was the potential for it to be extended. So I have not seen the response to the shutdown yet that we are hoping for. And so I think that does raise the possibility that we may see an extension of this shutdown.
Okay, thank you. Another question. Do employers have to let, I know we've talked about this before, but we've talked about so much. Do employers have to let staff know if there is an infection among staff?
I'm not, do they have to let them know? I think it's recommended that employers do communicate with their staff, and that's mostly because we know how quickly social media works and how quickly rumors spread. So providing staff with accurate and timely information, I think is really important for employers. So whether or not there has been transmission in the workplace, communications is always better. It's always better when it's proactive. That said, once we have confirmed that there is transmission in the workplace, or that there may have been transmission in the workplace, we would work with employers to ensure that there is communication, both internally and also potentially externally, if we believe that there was an increased risk to people, to clients and customers.
Okay, thank you. I also have a question. I'm going to ask you after this, Dr. Salvatierra, just quickly about the overdose alert, but I had a question for Teresa. Teresa, were all your staff instructed to wear masks at all times, even just among themselves?
Yes, so we have a directive from the Ministry of Children, Community and Social Services that our staff need to wear masks at all times, unless they are eating, in which case they need to be eating alone, separate from the area where we're offering supports. And additionally to that, our staff need to also be wearing either a visor or goggles whenever they're interacting with people we support in our homes. So that is a directive for all our homes.
Okay, thank you. So Dr. Salvatierra, just the last question here about the overdose alert. Can you maybe, I know it's off COVID topic, but can you maybe just explain a little bit, fill us in a little bit more about this overdose alert? Because it's about a poisoning, sorry, not overdose, poisoning. So,
well, so Jessica, the technical word really is poisoning, because these are people who are not intending to consume more of the substance than to induce an overdose, but they're being poisoned because the substance in it is contaminated with fentanyl or a fentanyl derivative. So when I speak about these deaths, I use the word poisonings, even though I know the public tends to use the word overdose. So we might use them both, but the actual correct word is poisoning. Does that help?
Okay, that's it. Yeah, well, we have someone else working on that story today, and it's just something that I had to ask for them, and that's great. Thank you. Those are all my questions. Thank you very much.
Okay, thank you very much, Jessica. Okay, I don't think I see any other media on the line. So we will begin to wrap up. I just had two quick announcements that I did want to share with everybody. So a news release will soon be going out about this, but on Friday, January 15th, Dr. Salvatierra will be offering a presentation online similar to what we're experiencing right now for residents to tune in and ask questions about the vaccine. So we will be promoting this. It's registration will be through Eventbrite, and then they'll receive the link on MS Teams so they can join the event, which will happen at 2 p.m. Not this Friday, but next Friday. So, I think I see Joelle has a question. So just please bear that in mind. So I'll move on to Joelle, and then I'll finish up with my last announcement. So sorry to have missed you, Joelle. Please go ahead.
Okay, it's okay. Lots has been covered already, so I won't be long. I had a follow-up for Teresa. It seems to me that you said there are about 3 to 8 people that live in each of the community living homes, plus some staff. So if there were 14 cases, does that mean that everyone who either lives or works there was infected, or do I have that wrong? Is there maybe alternate staff who went in?
Yeah, no, great question. So, so it's staffed 24 hours, and in order to live in one of our homes, generally needs are fairly complex, and so for instance, for the home that is an outbreak, 5 people live there, and there could be 1 staff, usually on the overnights, but up to 3 or 4 staff during the day. So there were 18 staff tested, 9 staff were positive. And as I'd mentioned, I think to you yesterday, given that 9 staff tested positive, we have had other staff that don't usually work at that home that have joined the team to get through outbreak, but currently there are 18 staff on that team.
Thank you so very much. That helps me to understand that. Thank you. Another question I had for either, I think maybe Dr. Salvatierra will be able to answer this one. It's regarding vaccines. Minister Monsef was talking about how the vaccine data will be available on the federal government website. Is something similar going to happen locally? Like, will we be able to see online how many vaccines have arrived, how many have been administered? I see there's a new section for vaccines. Is that coming?
I think that there's a good likelihood, Joelle, that we can report daily on both our numbers. Now, once we have them in stock, it depends on the vaccine and whether if it's Pfizer, it won't be coming to Peterborough Public Health. It'll probably be stored at the hospital. But certainly once we have vaccine in stock, the information infrastructure that we are being given by the province to use to administer the vaccine will be able to produce those sorts of numbers. So we should be able to track locally how many people have been immunized each day, and we can probably do a cumulative total, but we're just learning what the capability of the new information infrastructure is. And so, but I do think that's certainly within scope.
Thank you so very much. And my last question is about COVID at the First Nations. I noticed there was a case there's fewer than 5 cases at Curve Lake. Recently, is that their first reported cases? I hadn't seen anything prior to about a week ago there.
No, that is not the first time that Curve Lake has reported any COVID activity. But for more information, I think it would be best to contact them directly.
Okay, and are the 2 First Nations going to have priority access to vaccine? I see you're going to be speaking to Hiawatha soon about this. Can you talk about that?
Yes, well, so Indigenous peoples have been identified as a priority, and so we have had a preliminary planning meeting with both Hiawatha and COVID. For H1N1, they were the first people to get vaccine. We went out immediately and immunized there. And for a COVID-19, it'll really depend on getting the vaccine from the federal and provincial governments. Right now, I am aware that remote and northern fly-in First Nations are beginning to be immunized or will be immunized soon. What we are waiting to hear is whether southern First Nations will also get access, priority access to the vaccine. I still haven't received any confirmation on when we can do Hiawatha and Curve Lake, but we are, as I said, we certainly met with them, and we are planning to go in and assist them with administration of vaccine when we get a supply.
Okay, thanks so much. Everyone else asked wonderful questions, so thank you. Okay.
Thank you, Joelle. So I will just quickly call out if there are any other media on the line. Otherwise, we will just wrap things up. And my apologies if I've missed you. It's sometimes hard to see who's signed in or not. So thank you for making your presence known if you can in the chat box. Okay, so as I was mentioning, we are planning to have an opportunity for community to learn a little bit more about the vaccine. And Dr. Salvaterra is running an event on Friday at 2 p.m. and the information is forthcoming in a news release, so please look for that. The last announcement I wanted to let this group know is that we are ramping up these media briefings to twice weekly starting next week. And again, an advisory will be going out to our media colleagues so that they can tune in. The plan is to run these on Tuesdays and Fridays. And again, we are inviting our elected officials to join us when they can. So please watch for this advisory to be going out shortly. So we will not be meeting next Wednesday, but we will be meeting on Tuesday and Fridays going forward. Okay, so then with that, I think we are complete for today. Thank you so much for your continued interest in these, and all the best as we kick off 2021, and we look forward to seeing you next Tuesday. Thanks all.
Thanks, Brittany.
Thank you.
Thanks, everybody.
Thanks, Brittany.
Okay, bye. Thanks, everyone.
Have a good day.